Hi, my name is Rachel Leong, and I will be presenting my poster on comparative analysis of energy expenditure equations in overweight and underweight adult hospitalized patients. My group and I have nothing to disclose. Starting off with background, providing optimal nutrition support therapy mandates the provision of appropriate amount of calories for each patient. The measurement of the resting energy expenditure, or REE, is the gold standard for determining energy needs, and the most accurate way to measure the REE is through indirect calorimetry, which uses measured oxygen consumption, carbon dioxide production, and estimated nitrogen excretion to predict REE. Indirect calorimetry is not performed on all patients. Therefore, predictive mathematical equations have been designed that estimate REE based on patient parameters. Some common equations for adult patients include the Harris-Benedict equation, or HBE, Mifflin-St. Jeor, Ayrton-Jones, and many more. The purpose of this retrospective chart review study is to determine the equation that most accurately predicts the REE in overweight and underweight hospitalized patients by comparing the results to indirect calorimetry. The primary objective of this study was to compare the calculated REE from the Harris-Benedict equation with modifications to the result of indirect calorimetry. For secondary objectives, the first was to compare the calculated REE from equations including the Mifflin-St. Jeor, Penn State, as well as its modified version, American College of Chest Physicians, Ayrton-Jones, Fazey, and Owen to indirect calorimetry results in underweight and overweight patients. The second secondary objective was to look at the differences in accuracy of the equations in predicting energy requirements for patients in ICU versus the floor. Inclusion criteria includes patients greater than 18 years old who have a BMI less than 18.5 or greater than 30 kilograms per meter squared, and who have had indirect calorimetry performed between January 1st, 1990 to June 30th, 2013. Exclusion criteria include if the patient was receiving supplemental oxygen, their mechanical ventilation was leaking, any amputations, spinal cord injury, or underlying chronic pulmonary disease. In terms of our results, there were 81 patients in the obese patient population at an average age of 53, average BMI of 38, and females were around 60% of this population. For the underweight population, there were 80 patients. They had an average age of 50, average BMI of 16.2, and the females were around 60% of that population. Looking at the primary objective, for both the obese and underweight patients on the floor, the HBE equation was not significantly different from indirect calorimetry, with the p-values included below. Looking at our secondary objectives for our overweight population, in the ICU there were 40 patients, and on the x-axis it includes the BMI ranges, and the y-axis the percent within 10% of indirect calorimetry. And to the right is the key of the equations used. Looking at the BMI 30 to 40 range, the HBE equation was superior. For the BMI greater than 40 to 50 range, the HBE and the Owen equation were superior. And in the BMI greater than 50 category, the Owen and MSJ equation were superior. In terms of looking at overweight patients on the floor, where there were 41 patients, again, the same X and Y axis. In the BMI 30 to 40 category range, the HBE equation was superior, as well as for the greater than 40 to 50 BMI and the greater than 50 BMI category. So in conclusion, in patients on the floor, this data suggested that the HBE be used in underweight patients and the HBE adjusted for 50% BM be used for obese patients. The Mifflin-St. Jeor and Owen equations may be more accurate in patients in the ICU with a BMI over 50. And overall, there is a large role for indirect calorimetry in obese patients. Further studies are needed to confirm these results. For limitations, this was a retrospective chart review and thinking about accessibility and resources for indirect calorimetry. Below are my references. Thank you so much.